Good morning, I'm Elaine Morato, and this section that we have is just to get us started, a little bit as to why are we here, why do we care about dissemination and implementation, what are some of the promises and challenges. If we look at national agendas or folks that establish national agendas, what are they saying about this field? The objective of this section is to understand, as I said, the importance of this research and practice in achieving our Healthy America goals. I wanted to first, before I dive into slides, orient you with a little bit of the materials that you received. You should have gotten a workbook, a spiral workbook. And what we're trying to do here is model it so that as you walk away from the course, you actually have key references, resources, charts, figures, etc. that go along with the curricula that we're outlining. So there is a tab that speaks to this section. I will be alternating with my colleague Borshika Rabin, who will be also a key instructor in the course. And we'll walk you through, starting first with why are we here, then what are the frameworks and definitions that are tools for design, and then tools for evaluation, etc. And so the information that we'll be presenting in these more didactic sessions are contained within the workbook such that it's easy, hopefully, for resource. You should have also received an email that mentioned that the slides themselves are posted onto Canvas. So for those of you who are in the UCD system, Canvas is our new Blackboard for all courses. It's a free Canvas. It's not your Canvas if you're an academic and you try and go in there and you find it. It's not a course, right? So it's a public, open access Canvas. So use the link that we sent in the email and you'll be able to get access to all of the slides that the speakers are using, the case vignettes, etc. Okay? And what we'll also be doing is try to allow opportunities for Q&A and discussion. So there'll be a piece where we're didactic and we are providing information, but there's planned time for Q&A as well, and we'll be running up mics so that we have opportunity for dialogue around this. Okay. So I'm going to start first with some motivating quotes for why do we care about dissemination, implementation, research, and methods. About a decade ago, the Institute of Medicine came out with its landmark report on crossing the quality chasm. And in there is this quote that's often used in dissemination implementation. That is, research has shown that scientific knowledge about best care coming from research, such as NIH supported, etc., is not applied systematically or expeditiously into clinical practice. They estimated, based at that time, that it takes 17 years on average for information to get from the research publication, from that knowledge out actually into practice. And even then, it's only applied unevenly. So it recognized that a lot of the investment is going into generating this knowledge, but the translation's not happening. For those of us that think of it in terms of a framework the NIH uses in terms of translation science going from T0, T1 to 3 and 4, dissemination, implementation into practice, into community would be where you would say at T3 and T4. And the ideal goal would be that this is, moving along progressively from stage to stage. But others have noted, Larry Green, for example, and colleagues have noted that the translation is really more like a funnel or a pipe. Some have described it as a leaking pipe in which at each one of these steps things get lost in translation, if you will. And if you think of this 17-year odyssey in terms of going from peer-reviewed grants to publications, the reward in academics for grants and publications, not necessarily for the translation of that evidence into guidelines and much less into practice, we see that the challenge that we have is this reality of how do you work things through this pipe and more quickly. There's also a growing recognition, I think, of the challenge of OverTranslation in areas where we're overly good at getting people to adopt things that might actually lead to overuse. Some may be aware of this national program that's going on called Choosing Wisely. It's a collaboration with a number of national medical associations to try and encourage doctors and patients to have questions to see, are these tests really needed? Is it supported by evidence? So that we're not overly translating information and incurring harm in the process. Another challenge for the field historically has been it hasn't necessarily been a public funding priority. A follow-up report that came from the Institute of Medicine talked about it in these terms, that we as a country invest billions of dollars in generating research, in determining what are appropriate treatments or prevention strategies. Healthcare system as a large spends more than $1 trillion on the delivery of healthcare annually. And yet we have this extraordinary knowledge and capacity to deliver the best care, but we repeatedly fail in translating that. Others, such as I know Russ, have reported on the pennies to the dollars. If you look at the ratio of money that has historically gone into dissemination and implementation relative to the amount invested in R&D, it's only pennies on the dollars. I like to draw an example from private sector. If you look at the pharmaceutical industry, for example, and there's a government accounting report on where they spend their dollars, it's more like 1 to 3. Or I should say 1 to 2. 1/3 of their expenditures are going into promotional dissemination and implementation. So for every $2 they're putting into research, they're putting $1 into those activities. So this has been a growing awareness of how do we put more effort and energy into funding it, and how do we think about using existing infrastructures in a way that allow us to be systematic in how we translate the knowledge. You'll be hearing from Julie Lowry around the approaches that the VA has taken to be more integrative, I believe, in how we think about translating the evidence in a systematic, in a research-informed manner, and using the infrastructure of the VA. You're hearing discussions of this with the CCTSI infrastructure. How do we use the established community engagement cores, the networks that are available with the healthcare systems that are linked with these CTSA nodes in a way to be more systematic in the translation? And so for these reasons, I believe that the field itself is going through a transformation. I think part of it was triggered actually with the economic stimulus funds that occurred a few years ago. This is a figure that came from a paper from Health Affairs in which they looked at the funding that came out of the ARA funding. It's colored based on what department spent it, and then each of the columns speak to the type of funding that it went to. And you can see here that 90% of the funding was spent on developing and synthesizing evidence and improving our research capacity. For those on campus who are familiar with the DARTnet infrastructure, familiar with SafetyNet, I know we have Lisa Schilling here, that's where a lot of the funding went, is to create these kinds of data registries to allow us to conduct the research. But I think what was very important at the time was that the authors noted that as we think of future funding in the field, priorities for new funding should emphasize dissemination of those results, not just the generation. And you see this as you move on to PCORI. So the Patient-Centered Outcomes Research Institute was enacted as one of the provisions of the Affordable Care Act. All right, so this is a funding agency that was or foundation, nonprofit, external to the government, a combination of government, private sector, and academics, whose mission is to help ensure that patients and providers have information to make informed decisions about their care. It was initially jump-started out of federal dollars, but as it gets going, and we're at that year of 2013-14, there's a fee that's imposed on all health plans, $1, and then I believe it goes up to $2 for everyone that's an insured life. And that this money goes into a pool, into the trust fund, and if you look at the total amount of spending, we're looking at about $3.5 billion in this research, and part of the provision is that a certain percentage, 20%, needs to be funded in dissemination, implementation research, and capacity building in that area. And a good chunk of that is being directed to the Agency for Healthcare Research and Quality. So for those in the research side are paying attention, when you see things come out of ARC for new grant proposals and they're talking about patient-centered oriented research, it's being driven in large part from a piece of this funding mechanism. And you're seeing now continued examples of funding into what ARC has done historically, which is to focus on transforming research into practice, to facilitate wider access to effective health care, and centers along that line. So our Center for Research and Implementation Science and Prevention was one of those efforts that was funded out of this funding stream. You also have NIH that's been funding in this research area. There's a nice paper that came out this year by Tinkle and colleagues that talk about the funding for NIH dissemination implementation over the last 8 years or so, and the number of awards. I think there's some exciting news in terms of, and we can talk to Russ on these at breaks as well, but as I'm interpreting it, an expanded scope of what this research portfolio can do. So historically it's been, do you have something that's shovel ready to implement? Now go do it. Now there's a broadening let's also be looking at methods that might support the field as well. There's also, I would say, a related line of research that is in this healthcare systems research collaboratory. It's geared towards doing very large pragmatic trials, but I think what's important for the field of dissemination implementation is that it's trying to do research so it's implementation ready, right? So by engaging with healthcare systems in similar ways to how the VA engages in between research and translation, but doing that on a more larger national scale, I think will give more opportunity for more seamless translation between the practical research and the application. And there will be more funding announcements in this area as well. We mentioned the VA. Their initiative is the Quality Enhancement Research Initiative. This is actually probably the oldest of all of these streams of activities, starting in the late 90s. And there's a lot of learning from there. You'll be hearing a case vignette from Julie Lowry. One of the breakout sessions allows her to go more in depth in what they are doing in the VA and the systems and constructs that we can learn from in other application areas. The CDC, also, as they are renewing their prevention research centers, is having more of an emphasis on the implementation as well. One of our guest speakers is Ross Brownson, who co-directs the St. Louis University and Washington University Center, PRC, and out of that group is coming some very exciting information around how do we think about D&I models to inform what we are doing, that allow us to bridge this gap between research and practice. So there is a more bubbling effort to give guidance to both public health practitioners as well as clinicians. So that's what's happening on a national scale. I wanted to touch base a little bit on our own community because it's with this information that we tried to design the course. Last spring, we asked individuals to hold a date so that we could start planning and thinking about what would be the right kind of curriculum to meet the needs of our own local community. And we had over 100 individuals on campus and extended to campus interested in this, and we asked you all some questions. So if we think about who is our community in terms of our professional roles and our affiliations, I think it reflects very much the faculty that we have involved on the course and the curriculum. We have individuals all the way from academic faculty to students and fellows, but also providers, both in a healthcare setting as well as public health professionals, as well as others. So we're a very diverse group, and as Ali said, our hope is that by bringing this forum together, we can be learning from one another in the diverse settings in which we are operating. Our affiliations are also very diverse. While the largest group represents School of Medicine or medical kinds of backgrounds, we see a significant number of us in public health, coming from nursing or dental medicine, from our related healthcare systems of Kaiser, National Jewish, VA, Denver Health, Children's, and others. So again, a diverse setting among us here in the auditorium. Where is our level of knowledge? Now, this was at the time of people expressing their interest to participate. And we found it interesting. We have about almost 50-50, if you look at it, of folks who are saying, I am new to the field. Help me understand. It sounds exciting, or I'm interested. Help me understand what are the terms and definitions. And then we have another half of you who probably have a basic understanding, who are already conducting research and are wanting to incorporate dissemination, implementation strategies, constructs, measures into ongoing research, perhaps to be competitive for grants that are asking for that, perhaps to be doing quality improvement more effectively. When we look at what do people hope to get out of the course, we also see a dichotomy, or a good diversity. Some of you want to apply for a grant. Some of you want to incorporate these principles into existing projects. And some of you are thinking about how can I be more systematic in how I think about quality improvement, both in terms of the design as well in terms of the evaluation. And it's for this reason that we've tried to bring in folks that are representing these various disciplines and interests. This is why we wanted to have some of our faculty reflect people who are actually on the ground saying, it's not just theorizing, here's how I'd like to do it and design it, but what are the practical aspects of trying to conduct this kind of research, etc. Ali has covered the workshop. I just want to say, today is a boot camp of sorts, to make sure we're all on the same ground in terms of terminology and approaches. And it's the combination of bringing in experts into this that we hope will make it lively for those at different learning stages. Tomorrow, recognizing that we have folks that are already doing these kinds of projects or are thinking of it, that was designed as to mirror if you were to apply for the NIH has a training institute. They have this mentored aspect through the course, and we're doing a mini version of that. Our design, as Ali has said, is this combination of didactic. We're breaking it up with small group application, the workbooks, such that we hope that you have some ready-to-use tools when you leave. It's not just a thought piece, but rather some approaches, tools, checklists that you can start to apply right away. I mentioned the slides on Canvas, and I just want to reiterate to Ali, at the next week you will be getting an email message to evaluate, and we want to hear from you areas that worked well, areas where you'd still like more learning and knowledge, and we can incorporate that into future training. All right. The other piece that we are trying to do at the end of each of the lectures is just to have some summary notes, some key takeaways. So if you were to get started in your own field of interest, what might be some key questions to ask yourself? So just to model that in my first piece, if you were to think about, I talked about on a large national agenda, in your field of interest, there's also agenda setters. What are the emerging issues and topics for your field? Are there unique D&I challenges that have been expressed in your field? What are those opportunities? Who else might be working on that kind of research and practice, either here locally on campus or nationally? And therefore, who might we be able to collaborate with? So we'll be closing each of our sections with those kinds of thoughts. I talked, why are we here? I'm going to introduce now Borshika Rabin, who's going to get us kick-started on what are we all talking